Thank you for choosing CalISO Corporation and allowing us to share some helpful information with you regarding the preparation of a 510(k) submission for the FDA. This presentation is a brief summary of the requirements for filing a submission with the FDA. It will also refer to current links to some very important information that the FDA provides as a guidance for successful submission. These links can be found on our website at www.caliso9000.com/FDA_510K and will be annotated throughout the presentation with an asterisk. Please note that each submission is unique and not all requirements for all devices will be covered in this presentation. We often get phone calls from clients who ask, "Where do I start?" The very first step is to determine if your device is a medical device or not. The FDA has a very clear definition of what a medical device is and what isn't. You can find the definition of a medical device in the link, "Is the product a medical device?" You then need to determine what predicate device you will be using as a comparison to your device if you haven't already done so. Generally, a predicate device is a device that is similar to the device you are submitting to the FDA either in design or intended use. A 510(k) is a pre-marketing submission made to the FDA to demonstrate that the device to be marketed is safe and effective by proving substantial equivalence to a legally marketed device. It is helpful to review the link "How to Find a Predicate Device." Your next step is to determine the classification of your device, which will help you determine if it requires submission or not. A helpful link for this is Device Classification Panels. Most Class 1 devices and a few Class 2 devices are exempt from pre-market notification requirements subject to the limitations on exemptions. All medical devices must be manufactured under a quality assurance program, be suitable for the intended use, be adequately packaged and properly labeled, and have establishment registration and device listing forms on file with the FDA. 21 CFR Part 820 Quality System Regulations is the quality assurance program under which all medical devices must be designed and manufactured. Manufacturers must establish and follow quality systems to help ensure that their products consistently meet applicable requirements and specifications. The FDA does not perform 510(k) pre-clearance facility inspections. The submitter may market the device immediately after 510(k) clearance is granted. However, the manufacturer should be prepared for an FDA quality system inspection at any time after the 510(k) clearance is received. CalISO does offer an online course that details the requirements of this regulation. The next place to review is the Guidance for Industry and FDA Staff format for traditional and abbreviated 510(k)s. The current document was issued on August 12, 2005 and revised November 17, 2005. The main focus of this document is to provide guidance on how to format an original submission for a traditional or abbreviated 510(k). The guidance document provides only a general framework for the format and content of a traditional or abbreviated 510(k). It does not describe recommendations for any specific type of device. It is very important to remember that in order to speed FDA review, that you retain the section headings in the sequence listed in the guidance document. If you feel that a section does not apply, it is recommended that you include that section and simply state, "This section does not apply," or NA under that heading. For example, if your device does not contain software, it is recommended that you state this in the Section 16 titled Software. Depending on the type of device you will be submitting, there might be additional guidance documents specific to that device. FDA has published many device-specific guidance documents, as well as general guidance for biocompatibility, software contained in medical devices, electromagnetic compatibility, etc., and these documents are available through the guidance document page. Once you have your submission together, your next step is to prepare it for filing with the FDA, or if you choose, a third-party reviewer. Details regarding third-party review can be found in the link Third-Party Review, What is a Third Party? There are some benefits to submitting your device to a third-party reviewer before the FDA. You will pay the third-party reviewer rather than the FDA for your submission. They will review the submission and then send it directly to the FDA for final approval. It's generally understood that the relationship with a third-party reviewer is a little more user-friendly, and the submission should flow a little easier. You will know when you classify your device if it is eligible for third-party review. Here is a sample of what you might see when you do your device classification. It will say, eligible for accredited persons program. You will also see the list of accredited persons who are eligible to review that device. If you choose to submit directly to the FDA, there is a specific method that needs to be followed. Please review pre-market notification 510(k) review fees. Payment of the review fees must be received on or before the date you send in your submission. If the FDA received an application without payment previously being made in full, it will consider the application incomplete and will not begin its review. The FDA will adjust these fees each year to account for inflation, changes in workloads, and other factors. The FDA will announce the new fees for the next fiscal year in a Federal Register notice by August 1st of each year. Submit your pre-market notification and include a copy of the medical device user fee cover sheet with your submission. You should complete the medical device user fee cover sheet, Form FDA 3601, by following the instructions online. A 510(k) should be put in a temporary, inexpensive binder. Do not permanently bind the application. The FDA will take the submission out of whatever kind of binding you've submitted it in, 3-hole punch in the left margins, and put it in a 3-ring jacket for review. Your paper size should be 8.5 by 11. You must submit 2 copies of your 510(k). One must be mailed and the other must be submitted in an electronic format. Details of how to submit electronically can be found in the link Electronic Copies for Pre-Market Submission. Please note that the FDA does not return the 510(k) once they've completed their review. There is a time frame that the FDA follows in reviewing and responding to your submission. Please review Guidance for Industry and Food and Drug Administration Staff, FDA and Industry Actions on Pre-Market Notification Submissions, Effect on FDA Review Clock and Goals. Generally, within 15 calendar days of receipt, the FDA will conduct an acceptance review to determine whether the submission is complete and can be accepted for review. Once a submission has been accepted, the FDA should conduct the review and communicate with the submitter within approximately 60 calendar days of receipt of the submission. If the submission has been found to be substantially equivalent, then an order declaring the device to be SE or substantially equivalent is issued to the 510(k) submitter, stating that the FDA has determined that the device described in the 510(k) submission is indeed substantially equivalent to a legally marketed device. An order declaring a device to be SE authorizes marketing of the device in the United States subject to specific statutory and regulatory requirements of the FDA. If for some reason the submission is insufficient in any fashion, then the FDA will request additional information. A response to an FDA AI request is a submission of additional information addressing all of the deficiencies identified in the AI request. That allows the FDA to continue or complete the review and reach a decision on the 510(k) submission. The FDA will automatically grant a maximum of 180 days from the date of the AI request, even if the submitter has not requested an extension. This should give the submitter adequate time to fully and properly address all the deficiencies identified. The request for AI stops the review clock until such time that the submitter responds to all of the deficiencies. Once the response is received by the FDA, the 90-day review clock starts again. You must register and list your device. The link, Who Must Register, List, and Pay the Fee, will be very helpful to determine if you must register and list. If your device requires pre-market notification clearance or approval, you will have to wait until your pre-market submission is cleared or approved to register your establishment and list the device. The FDA has a very specific method to register and list your device. Please review the link How to Register and List for details. Registration information must be submitted each year between October 1st and December 31st, even if no changes have occurred. This is known as annual registration. Thank you for viewing our presentation. We hope you have learned from the content. Again, the links discussed in this presentation can be found on our website at www.caliso9000.com/FDA_510K.